And my guest of honor tonight, Dr. Donia Shoair, who is the professor at the National Research Center. Dr. Donia, the country has taken many measures in order to be having a very important defense line against COVID-19. So had prioritized also this important file. How do you see those measures? And having those measures in place definitely did contribute to make the situation under control in Egypt.
Exactly, indeed. These measures actually were taken in the appropriate time. They were suitable with the condition of the spread of the virus. Actually, the preventive sector, the preventive medicine sector at the Ministry of Health and Population, taken two strategic ways. First aim was to reduce the number of infection and death of the patients.
Yeah.
This was the first thing, is to reduce this number, okay? Second is to maintain the continuity of these preventive measures to be efficient and to be effective and efficient, okay?
Yes.
Through many actually steps, starting from the quarantine hospitals, okay? The surveillance measures, okay, that were undertaken, okay, the early detection of the COVID-19, okay. So I can see that these measures, okay, contributed in this situation right now that we have passed three waves of COVID-19 successfully.
Yeah.
As you can see that many countries suffered from health system collapse. So, and we are, okay, we
thank God, yeah.
Thank God, yes.
Definitely it helped a lot, and the president had ordered drawing up of an executive plan in order to vaccinate the students, especially before the academic year. We have the workers at the universities, the academic staff, the administrative staff. This is very important. We do have, like in October, the academic year is going to start. How is vaccinating the students contributing today to curb this virus? And what's your advice in that respect concerning for the students, all the students who are going to welcome the new academic year in less than a month?
Yeah, we suffered from the school closure or the absence of students,
yes.
Especially the students of the young age that who do not have the ability to use the internet to make the e-learning. Okay, so these students suffered a lot. So if we vaccinate all the staff and the students at the schools, so we will be able to be back and to get a normal school year.
Yeah.
Yeah.
The normal school academic year, especially for students also above 18 years old.
Yeah.
For the upcoming school year, it has become now compulsory that they would take the vaccine.
And the universities.
And
sure.
the universities, definitely.
Yes.
Around 1.6 million employees have so far been vaccinated, according to the health ministers. So we're talking around the whole world of the issue of mass vaccination and how mass vaccination, in your opinion today, is contributing to curb this virus and prevent it from spreading.
Yeah, actually the target to control this pandemic is to vaccinate about 60 to 70% of the population. Actually, this will take a little bit more time, but if the people
cooperate
yes, with the vaccination and get the two doses of vaccine, so we will escape from this stage, especially in the fourth wave that we are facing now, because we have that Delta variant, okay? So if we get a large percent of people who will get the vaccine, so we will be able to face this fourth wave, especially the Delta variant.
Yeah, the Delta variant has been like in the headlines recently, and the whole world is talking about it, and it's spread in different countries. How far would the symptoms of the Delta variant vary from the first COVID that we knew? And are we expecting more variants of COVID-19?
As you know, that the virus is always mutating. Yeah. And this mutation can lead them to be more or less dangerous, okay? And we have thousands of strains, okay? But sure, the surveillance for the fittest, we have about 4 or 5 dangerous variants: alpha, beta, gamma, and delta.
Yeah.
Okay. We are facing now Delta variant. The symptoms of Delta variant do not. These symptoms are the same, like the previous, like the alpha variant.
Yeah.
But the difference here that it affects the children. The children are
very much susceptible to contacting the virus. Yeah.
Yeah, yeah. And this is the importance of having the vaccines at this point and before the school year and before the university that will start next month.
Yeah.
To face this this variant.
Yeah.
Okay.
How about the rumors that we hear concerning the vaccines, you know? A certain segment are still quite fearful. However, with a sense of awareness, and the media is also playing an important role to tell all the people that it is the first defense line. Of course, the first defense line, we all knew that it is the mask. However, to have other defense lines for their health and for supporting of their immune system, it is the vaccine. So how about those who are yet fearful of having the vaccine? What would you tell them?
Okay, there is nothing to worry about. You should take the advice of your physician first.
Yeah.
Okay. We have 5 vaccines now in Egypt. Okay. All the vaccines have the same result, is obtaining the immunity or training the immune system to know the whole virus, and can trigger the immune system to deal with the real virus.
Yes.
Okay.
Yes.
So the difference lies only in the vaccine platform. Okay, we know that there is inactivated vaccine like Sinovac and Sinopharm. We have the RNA vaccine like Pfizer. We have the viral vector vaccine like this Johnson & Johnson, AstraZeneca.
Yeah.
Yes, so the difference in mechanism of action of these vaccines. So the people shouldn't worry about the vaccines. Everyone have if he has the right to choose anyone, it's better than getting.
But go for it. It's better than not having the vaccine at all, of course.
Yes.
Yeah, we're going to be back to discuss further this issue and the different kinds of vaccines and which is suitable, more suitable for whatever is suitable for me. Maybe it's not suitable for Dr. Donia. However, the whole physical situation should be examined first and according to your doctor's advice. Well, Mr. Jeremy Hopkins, the UNICEF representative in Egypt, said that combating an unprecedented global pandemic like COVID-19 requires extended collective work. Hence, we are really proud to be collaborating with our partners and donors to support the Egyptian Ministry of Health and Population that is working tirelessly in order to limit the spread of COVID-19. So that came in an exclusive that I had all the honor to conduct with Mr. Hopkins here on ITV International, and we've seen many international figures loading the Egyptian experience with COVID-19. Mr. Hopkins is definitely among them. Let's watch.
You know, we're here to support the government in its obligations to children, if you like. We are a source of expertise and a source of good international good practice, and we work with the government to fulfill its commitments to the Convention of the Rights of the Child, which they signed a while ago. So, you know, we work closely under government leadership and advise accordingly across the sectors. And most recently, during this pandemic, which still continues, I should say, it's been very challenging, but we've worked closely with the different ministries with whom we work to advise, to provide support where we can, and to respond to requests for support where we can.
Yes, definitely. Well, the whole world was brought to a standstill during COVID-19. However, UNICEF had responded professionally to this pandemic. So if you would kindly highlight the measures that has been undertaken in order to fight the pandemic and at the same time to continue working, because life goes on.
It certainly does, yes. So at the onset of the pandemic, I think the whole world was reeling a little bit, and so we stepped in where we could with some very specific supplies. For example, we provide about 6 million pieces of protective equipment for the Ministry of Health to use. We stepped in with some emergency funding that we could find here and there. As things have settled down, we are sort of going to our normative role, which in the pandemic is twofold with the Ministry of Health. And one is providing support on logistics and cold chain, which means the vaccine cold chain, so that vaccines are kept cold until they need to be used. And the other piece is the behavior change. As you know, a lot of the response to the pandemic has been to try to persuade Egyptians to behave in a way that will keep them safe. Mask, distance, hand washing, essentially. And now, of course, there is a whole behavior change piece around the vaccine acceptance. So that's another area where we're working closely with the Ministry of Health.
That's
but
great.
then we have the other parts of the impact, which has largely been around education. Of course, we well know that the challenges all over the world were how do we keep children learning during the pandemic, during this period when schools were closed. So we've been accompanying the ministry to provide expertise where we can, support where we can, to make sure that the most vulnerable children continue learning from home during the pandemic, and back at school as soon as it was safe and the government deemed it safe for children.
Yes, thank you, Mr. Hopkins. And as we've seen in excerpts of the interview, Dr. Donia, he mentioned the main defense line, namely the mask and keeping the distance, as well as to continue wash our hands. What else can we do in order to further boost our immune system? Are there specific kinds of food or drink that would help us and definitely become active as a defense line as well? To curb this disease?
Yeah, sure. Because the immunity is not. He talk about the prevention or the preventive measures.
The precautionary measures.
The precautionary measures. Yes. Actually, the immunity is boosted by different ways, like eating the healthy food. Okay, you should avoid all the junk food. Okay, you should drink the appropriate amount of water daily. Okay, and eat fresh vegetables. Okay, at your lunch, and also you should avoid all the you should eat all the fresh vegetables, okay, and avoid all the junk food, avoid all the soda drinks and
Yes. That stuff. Yes. So,
yes,
so mainly stick also to natural products.
Yeah,
Because
actually.
they are definitely considered to be a boost to our immune
Immunity,
system.
yeah.
Yes, definitely. Egypt is collaborating today with the whole world, as we've seen the UNICEF representative, Mr. Hopkins, has been saying, and not only collaborating with UNICEF, but also supporting the different African countries in the fight against COVID-19, and also with the different consultations going on on the ministerial level, regionally and internationally, also to know the latest concerning the research in that direction. How do you see the efforts that has been exerted in that regard, and also the efforts that the National Research Center carried out to curb COVID-19?
Actually, the research is very important to curb this pandemic. We have made different researches concerning this, starting from the detection kits. We are the rapid detection kit of COVID-19.
Yeah.
Also, we are working on the vaccine. Okay.
Yeah.
The Egyptian vaccine.
Manufacturing the Vaxera.
Yes.
Yes.
Yes. Yes.
Yes.
Okay.
We want to tell our audience also more concerning the efforts behind manufacturing a vaccine here in Egypt. I mean, we always hear the announcement, but definitely behind the announcement, there are lots of efforts exerted in that regard.
Oh.
And you, as a professor at the National Research Center, you followed up those steps maybe closely because you are more in the kitchen.
Yeah.
So tell us more about this story, and is it much more suitable for us, this sense of collaboration with the Chinese manufacturer?
Yes, okay. Actually, there is a great project. It's called the Medicine City.
Yes.
Yes, it's very important project. Okay, that will make it will be like a hub for the international pharmaceutical companies. Actually, it provides a safe and effective pharmaceutical products, and it will make the medicine more affordable for the people.
Yes.
Okay, it will control.
It will provide us with quality medicine, but at the same time at affordable prices.
At affordable prices. And also, they are looking to for making medicine like hormone medicine, vaccines, okay, antibiotics, okay, all these drugs, not that the traditional types of drugs, no, but the high-tech.
According to the latest high and technological standards.
Yes.
Yes. How are the world looking to a project, the Gyptopharma City or the Medicine City, in your opinion? What is really significant about establishing such a huge project? What would be the international also reflections vis-a-vis this project? How will the world also cooperate with Egypt's Medicine City?
Actually, it will be like an international hub for the pharmaceutical companies.
Yes.
That will come here and invest in Egypt. So I think it's very important, and also they will put an end to the monopolistic strategies, okay, of the pharmaceutical companies.
Yes.
So
we have excerpts here of the different visits by President Abdel Fattah al-Sisi, and inaugurating more than one important project in the health field.
Yeah.
Yes.
It contains different factories. One factory for the solid preparation, pharmaceutical preparation, like capsule, tablets, and etc. One factory for the semi-solid preparation, like the ointments and the creams, and the third one for the sterile preparations, like the intravenous preparations, and so.
Yes. Very important projects that definitely is going to make our lives easier, because it is always great to have products made in Egypt, especially also regarding medicine and in the health sector. So at this timing, while we are fighting COVID-19, having such a medical city or medicine city is definitely a news that the whole world received with a sense of pride. During the inauguration of the medicine city, President Sisi stated that Egypt is prepared to localize the drug industry in the country, and that Egypt is also working on manufacturing the oncology drugs. So this is also a very important point, that we are working on more than one specialty, more than one dimension.
Yes. And actually, all these initiatives and projects are complementing each other. As you can see, 100 million healthy lives.
Yes, 100 million صحة, or the 100 million health initiative, a very important presidential initiative. And this is what we call the foundation and a defense line that came, as we find Egypt today having an infrastructure to fight not only COVID, but many illnesses.
Yes. This initiative is a complementary, yes, for the medicine city.
Yes.
Okay.
That's the Egyptian vaccine.
This is the Egyptian vaccine.
Yes.
I'm very proud.
Very proud, made in Egypt.
Yes, yes. Especially this is a vaccine, and before COVID-19, I wouldn't imagine that we will manufacture a vaccine here in Egypt. Okay.
But we have a great history, you know, in this field of pharmacology. I mean, vaccines against cholera, against many other diseases that we even as kids were vaccinated throughout. So Egypt has a great history and success stories also in the field of vaccination, right?
Sure. Yeah.
Well, talking about Egypt's weight medically and those huge projects like the 100 million Saha, 100 million Saha, and the upgrading of the infrastructure in the medical field, and the diversification also of partnerships with different countries. How will this variety reflect on the quality of the health services received?
Yeah, all these experiences, okay, like the cooperation between the National Cancer Institute and the French Institute of Oncology, that has been done 2 days or 3 days before. This one will control we will exchange the expertise between those cancer institutes, and this will make, for example, a diagnostic clinic will be opened here in the Cancer Institute, so that the woman can make all the diagnostic examination that is required to test if there any cancer or not in 8 hours. So it will facilitate the early detection of any disease, and it will improve the health of the woman. So all these cooperations and add an experience to us and improve the health of Egyptian people. Okay, so I'm very proud of all these initiatives.
Yes, definitely very important initiatives, as Dr. Donia said, and this sense of partnership with the whole world is definitely adding to our sense of exposure as well, and also having expertise, exchanging expertise with countries all over the world. This in addition, of course, to Africa. Egypt today continues providing aid also to many parts of the world during the COVID-19 pandemic fight. Let's watch.
Egypt is among the first countries to provide medical aid to others worldwide at the dawn of the coronavirus spread, as per President Abdel Fattah el-Sisi's instructions. Since the spread of the virus and the declaration of a state of emergency in Italy in April 2020, Egypt was among the first countries to provide medical aid in an attempt to help the European country contain the spread of the disease. The Egyptian government continued its efforts to strengthen its relationship with friendly countries as it sent a large shipment of sterilization tools to the UK and the USA after the death rates increased greatly and the medical equipment lacked. In March 2020, Egyptian Minister of Health Hala Zaid headed to China, carrying a message of solidarity for President el-Sisi and presenting a shipment of preventive medical supplies as a gift to the Chinese people. Also, the Egyptian government, based on the instructions of the president, sent medical aid worth $4 million to 30 African countries such as Mali and Sudan to help them in their efforts to contain the challenges resulting from the spread of the corona pandemic. This comes within the framework of Egypt's contribution to the African Union's African Fund to confront COVID-19. Moreover, the Egyptian government has always been keen to provide the necessary assistance to Arab countries such as Lebanon, Jordan, Iraq, and Yemen. With people everywhere struggling to preserve their livelihoods under the constant threat of the coronavirus, it has become clear that this pandemic is more than a health emergency. It has become a global whole-of-society crisis.
Dr. Donia, we're back and talking still about the fight against COVID-19, and usually many people, I guess, would ask you this question: when will the pandemic end? When will this nightmare come to an end? How about our resumption of our normal lives? When this normal life is going to be back? I guess you're asked all those questions a lot.
Yeah.
However, they are important questions, and on our mind as ordinary people as a whole. Yes.
Yeah, indeed. Actually, all the viruses last. Okay, no virus will end. They will last, but COVID-19 will last as an ordinary flu. Okay?
It will be like the influenza or the flu.
Yes, yes, but there are expectations that it will last till 2023. Okay, with these waves. Okay, and the
how long is
vaccination-
every wave, Dr. Donia? How is the wave? I mean, is there a time limit for every wave?
The time limit of every wave is 10 weeks, about 10 weeks. Yes. Yeah.
And the peak of the wave?
And the peak of the wave in the 7th week.
In the 7th week.
Yeah, yeah.
So Egypt is in the 4th wave?
Yes.
And the peak is expected to be?
In the 2nd of September.
The second half of September, beginning of October.
And beginning, yes.
Yes, around this corner.
Yeah.
Hope things will go safe, but definitely we need to take care more. We need to put on our masks. We need to keep the distance and boost our immune system. It's very important. We were talking while there has been the beautiful song concerning the Decent Life Initiative, and this is a very important initiative by the President in order to improve the quality of life of the ordinary Egyptians, of our brothers and sisters in the countryside. And how about the awareness for our brothers and sisters in the countryside of the importance of vaccination? This is also a very important responsibility.
Yeah.
And who can share in this sense of awareness, in your opinion?
Who can share? Actually, this is part of your
the media, definitely.
The media, yeah. This is the part of the media.
Yes.
And
maybe simplifying also the information on behalf of doctors, and they need to make maybe the basic information about vaccines simple, and they can reach the grassroots.
Oh, yes. Yeah. Actually, the simple information can reach the mind and very fast. We can say that this vaccine is like the common vaccines that we have taken before. So we have to make an immunity to avoid hospitalization, to avoid getting severe symptoms, to protect your parents.
Yes.
Okay, to protect the old age. Okay, you should take care about the people around you.
Yes.
Very
important issue is because it's not only our story, but the story also of our relatives, of our family, of our kids.
Yeah.
So people really need to take care. Leading a stressful lifestyle. We are all sometimes leading a stressful lifestyle, and sometimes our sleeping pattern changes, and they say that this would affect a sense of stress, or when you have some sort of insomnia, sometimes it affects your immune system.
Yes.
What's your advice in that?
Yeah, my advice is to sleep early and to get up early and to have the enough time for sleep. There are 8 hours at night, because this is the very important to boost our immunities, because there are hormones that act only and the body enters in the maintenance.
The maintenance time at night.
At night,
yes.
So the one should sleep at night early. The one should sleep at 10 o'clock.
So sleep early and try to get rid of the stress.
Yes, because the stress increase the cortisol, and this cortisol will decrease the immunity.
Yes, definitely. I thank you so much, Dr. Donia Shoair, professor at the National Research Center, for all the information and the piece of advice about the future of COVID-19 tonight. And also, how can we support our defense line, and while taking all the precautionary measures against COVID. Thank you so much, Doctor, for coming tonight.
Thank you. You're welcome.
Thank you. And I thank you, dear viewers, for joining us. I'm Taghrit Hussein. Many thanks for watching.